Church in Jamaica, Archbishop Kenneth Richards, head of the Roman Catholic Church, Dr. Peter Garth, the Jamaica Evangelical Alliance, Reverend Newton Dixon, the president of the Jamaica Council of Churches. We want to acknowledge as well other distinguished guests, ladies and gentlemen, members of the media, both on-site and online. Thank you again and welcome to this special conversation. We'll begin with the remarks from the minister, and just to note that all our panelists this morning are fully vaccinated, so they are allowed to remove their masks when they're speaking. Over to you, Minister.
Thank you very much, Stephen. Firstly, let me recognize the distinguished members who are sitting on both sides of the table. Pastor Brown, President of the Jamaica Union of Conference of Seventh-day Adventists, the Most Reverend Howard Ainsworth Gregory, head of the Anglican Church in Jamaica, Archbishop Richards, head of the Roman Catholic Church, Dr. Reverend Peter Garth, Jamaica Evangelical Alliance, and Reverend Gordon, Church of God in Jamaica. Other members of the clergy who are here, members of the media, those online listening on, distinguished ladies and gentlemen. It's a very important occasion and one that I am really grateful to the members of the clergy for agreeing, the leadership actually of the clergy, the church, for agreeing to be here with myself and other members of the Ministry of Health and Wellness. I believe Dr. Ennis is online, Stephen. I don't think you had mentioned her. She's head of our family medicine and the immunization program, so hopefully she'll be a standby resource if necessary. Welcome, Dr. Ennis. The occasion, we thought, became necessary because we have an important job as leaders of this country in all spheres of leadership. In my case, as the lead policy driver for public health as part of the government of Jamaica. In the case of the church and the faith-based organizations, the leaders who clearly provide guidance to their respective congregations across the length and breadth of Jamaica and to their particular institution. We are under threat. I mean, I don't think I can emphasize it beyond in a more simplistic way, but we are facing a clear and present danger as a society as we know it because of this public health concern called COVID-19, which has been dealing with us. I did not mention Reverend Dixon, Jamaica Council of Churches. I apologize. Not following my script, or I'm following my script and it's not here, so apologies for that. We are under threat, and it's important that as a country we recognize that the only way to overcome this public health threat is to address it in a holistic way, to address it in a way that mobilizes the population, firstly to understand the nature of the threat that we face, and secondly to recognize that we are all vulnerable and it requires a response that involves all of us. And we speak about the separation of church and state and so on. Those are discussions that are had and with some justification in particular contexts. But when it comes to securing the well-being, the welfare of a people, it is a solution that is going to require a coming together of all concerned. And so I really want to place firstly on record my appreciation to the leaders who are here today, to those who are not, but support. I've been on the phone speaking to a number of persons representing the church community. And I know, and I can say with confidence based on those discussions, that there is general consensus and support amongst the leadership for our COVID response program, and in particular, the vaccination program, which is the key theme of the discussion here today. So it's my job to say thanks, firstly, and to say that, by way of update, we continue to struggle with overcoming the COVID-19 threat. It's not a Jamaica thing, it's a global issue. We are in the midst of a third wave, which is seeing more illness, more hospitalizations, and unfortunately, more deaths. We are also at the sort of early stages of our vaccination program based on availability of vaccines. Started some time ago, but was disrupted because of lack of availability. We now have vaccines. Vaccines are not our issue. I'm just coming from the airport where we received 210,000 doses of the Pfizer vaccine. We expect AstraZeneca, we expect Johnson & Johnson next week, and each week or every 2 weeks, we will see arrival of additional supplies. So we have overcome that challenge, a challenge that was global in nature and which many times were outside of our control. The issue now is how do we mobilize the population around the value of the vaccine as the most effective response. And in so doing, we have to create an understanding, we have to overcome objections, we have to help our brothers and sisters, or the Jamaican people, to the extent that they are concerned, to the extent that they are uncertain, to the extent that they are fearful, to the extent that they need advice. The government's approach is to provide as much of this as possible. The government also appreciates that we don't control we are not always going to be the most credible, let me put it that way, in terms of the audiences that represent the society. We know that we have influencers at all levels of our society, the community, institutions, and otherwise. And indeed, frankly speaking, sometimes government is probably the least credible in making an argument for what is good, what is right, what is beneficial to us as a society. And so it is so important for us to forge those critical partnerships and to engage and involve our stakeholders who can carry greater credibility in making that case. And so our approach in the first instance is moral suasion by facilitating understanding of the challenge and an understanding of the response and overcoming those concerns, fears, or objections that arise. Vaccines have been around us forever, as far as I can remember. I'm the beneficiary of the early immunization program before I started school, the public school system, and I believe most, if not all of us are. And we have done well as a country. Today, there is more objection and concern than we have seen before. And this is really the challenge at hand. So I want to pause here, even though I was given a very big speech. I'm not speaking from the script because I want to speak from conviction and to allow our church leaders who are here to say their piece in terms of how they view the immunization program and really leave a charge and a message to those who they provide leadership for around the need for the vaccination program. And I will allow them to begin, and then we can open the floor for discussion. Stephen?
Thank you very much, Minister. So we'll begin with Dr. Peter Garth, and then we'll work our way to other members.
Let me say today that I'm extremely happy to speak on behalf of the Jamaica Evangelical Alliance. I have the full support of our executive board and the evangelical community for the most part. One of the reasons why we support the Ministry of Health in their campaign to have persons vaccinated is because we believe that as leaders, we have to take a very responsible position. I took the jabs because I've always believed what John Maxwell has said. Everything rises or falls on leadership, and I am of the firm conviction that leaders should lead from the front. And that's one of the reasons why I took the vaccine. I also took the vaccine simply because I believe in looking at the data, and I believe in doing research and looking at what is measurable before making a decision. So I am here today with my ministerial colleagues to say to us that we have come to encourage Jamaicans to examine the data, to do your research, to check with your medical doctor, and to consider seriously taking the vaccine. I want to say, and I say this publicly, that I took the jabs, my wife took the jabs, my daughter and her husband in Boston took the jabs, and my son, who lives in Trinidad with his wife, took the jabs. We are safe. We did not suffer any adverse effects at all, and we are convinced, having looked at the data in terms of persons who have been vaccinated, that it is far safer to take the vaccination. I want to say that I have been bombarded every day by persons who say to me, my pastor told me, if I take the vaccine, it means that I'm putting my faith and trust and confidence in the vaccine. That's very sad, because, you know, the Word of God says that faith comes by hearing, and hearing by the Word of God. And salvation, in and of itself, is not a matter of feelings. There are three coaches, and the number one coach is actually facts. Facts. Number two, faith, and then number three, feelings. In other words, my faith in God is based and built on the facts that are known, and I encourage Jamaicans to think seriously and to look at the facts. I want to close by saying that I certainly prefer to stand with God and be judged by anti-vaxxers than to stand with anti-vaxxers and be judged by God. I thank you.
I want to begin my remarks by saying how happy I am to participate in this press conference as we seek to educate and encourage citizens of Jamaica and members of our respective denominational groups to participate in this very critical and crucial vaccination program. I'm speaking this morning because I'm a citizen of Jamaica. I'm a Christian, and I've been asked to lead the Seventh-day Adventist Church in Jamaica. We're involved in not only a national but an international health crisis. And I believe that as a Christian and as a citizen of Jamaica, I have a moral responsibility to encourage my fellow Jamaicans and members of the Seventh-day Adventist Church to take the vaccine. I do this because the Seventh-day Adventist Church, prior to COVID-19, have always encouraged the members of the church to live healthy, to practice the basic laws of health, but recognize that disease is rampant in our community and around the world, and hence when one is infected or affected, one ought to seek medical help. Our members have in the past participated in vaccination programs. I have been vaccinated. I have taken the vaccine as a child, and on a numerous occasion when I have to travel on business for the church, I've had to take vaccine in order to enter different countries, in order to be healthy. And so today, without any reservation, I want to encourage the membership of the Seventh-day Adventist Church, but more so the citizens of Jamaica to respond to the opportunity to be vaccinated. I took my first jab 5 months ago, and subsequently I got my second jab. My wife, my 97-year-old mother-in-law, my 85-year-old mother, my 2 sons, we have taken the vaccine. And when I left home this morning, they were all doing fine. And therefore, I understand that when you go on social media, there are persons who are sharing different views. But the Seventh-day Adventist Church believes in the science. And we believe in the efficacy of vaccine. And so we are encouraging our members to be part of this program, to take the vaccine, whichever vaccine is available. Yesterday, I took time out to chat with a member of the community. And while talking with him, he told me that he was waiting. But I asked him, waiting on what? The evidence around suggests that most persons who are being hospitalized are those persons who have not taken any form of vaccine. And so after sharing one-to-one with him, he said, Pastor, I am going to sign up for my vaccine. But a few days ago, I was speaking with a colleague. He was infected in January. His wife and children. And after talking to him, he said, Pastor, I would like now to take the vaccine. And I call the health authorities, make arrangements, and next Tuesday morning he will be going to Olaba to take, he and his wife and children, to take the vaccine. I'm passionate about this. This is not, the Seventh-day Adventist Church does not teach and believe that by taking the vaccine, this is a covert way for authorities to track us, or a covert way for us to get what the mark of the beast. This is not a religious issue. This is a health issue. And when we have a health issue, we go to a health professional who advises us. And so today, I want to encourage all members of the Seventh-day Adventist Church. In March, when I took my job, I told them that having taken my first job, I would love if the wider community were able to take the job as I got it. And this morning, with the availability of the vaccine throughout Jamaica, I want to encourage members of my church, members of every denomination, citizens of Jamaica, let us be wise and take the vaccine so that we can cauterize the effects that would occur if we were not to take the vaccine. Thank you.
Thank you very much. You'd have heard from Pastor Everett Brown of the Seventh-day Adventists. We're going to now hear from the Most Reverend Howard Gregory, head of the Anglican Church in Jamaica.
Good morning, everyone. And I want to say it is a pleasure for me to be identified with this event being staged by the Ministry of Health and Wellness, and to say, first of all, that I support the efforts of the Ministry of Health in this program of vaccination as one aspect of addressing the coronavirus pandemic. I want to begin with a personal testimony, apart from the fact that I have been fully vaccinated, and so has my family. As a child in school, my mom was a teacher. And whenever the Ministry of Health came around for vaccine, as soon as they parked the vehicle, my mom sent to the class for me. And I was very much in the front of the line. I have never had a problem with vaccines. And no choice at that time, but in my work, as I travel different parts of the world, I have to take vaccinations, and I do that willingly and recognize the importance of it. Like most persons, when the COVID-19 virus came to the forefront, there were lots of questions, and of course, internationally, there was a lot of confusion. It was politicized, and the conspiracies started at that point as well. As an Anglican, and as one of the worldwide leaders of the Anglican Communion, we decided, the archbishops of the world, chaired by the Archbishop of Canterbury, we decided we wanted to find out the facts beyond what government had to say and what the media was carrying. So we met with representatives of the World Health Organization. And they shared with us in that meeting statistics and the information about the virus. But one of the things they pointed out is that the scientific community which they represent, they can carry out all of the research and they can develop the vaccines. But it takes a community to stop a pandemic. So it is not just about the science, it is about the community, it is about all of us. And one of the things we committed to do was to be part of the movement to build resilience and to commit to being credible voices in the midst of all of the half-truths and the conspiracies that have been spread around. And that is part of the commitment of the Anglican Communion across the world. It is also what I affirm and what I've been preaching for the diocese, but also for the country. But in addition, in order to get a better sense locally of the virus, I organized for my clergy conference a webinar with some of the medical authorities in Jamaica at the time, and had tremendous insights from the specialists as to the nature of this virus, the vaccines, the impact on the life of the persons, even with slides showing you how this thing impacts the physical body of the individual and the uncertainties as to the consequences. Therefore, as a diocese, we are committed to spreading that message to lend credibility and support to the efforts to deal with the vaccination program and generally to address the virus. I know that there are lots of questions that have arisen in the minds of persons, and particularly persons of a religious orientation as well. I believe that there is no inherent contradiction and conflict between science and religion. In fact, as this relates to the whole matter of healing, the God we worship is a God who seeks and promotes and provides for the healing of his people. This is part of the whole story of the life of Jesus, the miracles of healing. But it is also the reason why the Seventh-day Adventists have a hospital here in Jamaica. It is part of the reasons why the Anglicans have a hospital. It is part of the reasons why the Roman Catholics were invested in a hospital, because religion speaks to the matter of healing and the use of science and the research and benefit of science for the healing of persons. I recognize that there is an issue of trust, and I believe nationally, I think there was a bit of research some time ago which asked persons about what institutions and individuals they trust, and I think some of us will recall that. Our institutions are facing some serious issues of trust, and the minister spoke to that in terms of how governments are seen. But I think we need to recognize that that is the point at which we have to address this. And we're not going to build trust by just preaching at persons. A lot of it has to do with interpersonal relationships and meeting individuals. Some time ago, I had some workmen in my kitchen, and I overheard their conversation. They're not going to take the vaccine. And I looked at the youngest one, and I said, "Tell me something. You have any children?" And he quickly told me that he had about 6, what have you. I said, "Do you want to live?" And then he proceeded to say, "And I have several grandchildren." I said, "Do you want to live to see your children and grandchildren come to something?" He says, "Most definitely, most definitely." I said, "You have just given me the best reason for taking the vaccine." He said, "You know, I never see it that way, sir." So I believe that in our conversation with persons, it can make a lot of difference. I want to appeal also to religiously committed persons, but also to our nation, to think in terms of our responsibility to ourselves, but also to our community. Our Christian faith speaks to our love of God, but also our love of neighbor, our social responsibility. One of the things we are wrestling with at this point is what is the implication of vaccine hesitancy for our children and their return to school. We need to think seriously about how inaction and the consequences of this for our children. We need to think also of the consequences for others. This country will not be able to see its economic life return to vibrancy until persons, and a much larger number of persons, take the vaccine. So that is something that we need to pay attention to. Minister, I know there is an issue. I've heard that some of the older people are not able to get to the centers, and so there's a problem of mobility. I would want to offer my own church to say that where we have church halls, and even if in isolated communities, if our church building would be of use in getting the vaccines closer to communities, I would commit our church buildings for that purpose, because I believe it is important for the life of the nation. And I urge all our citizens, please think carefully about the decision you make and the voices to which you listen. Make sure they are credible voices. Thank you.
Thank you very much. We're going to hear now from Archbishop Kenneth Richards, head of the Roman Catholic Church in Jamaica.
As a nation, we are in crisis. And when the going gets tough, the tough need to get going. I have taken the vaccine, and I actually took it at a Seventh-day Adventist facility, both occasions. And I'd like to support all the government and my fellow clergymen seated here today in making an appeal to our citizens to have a responsible approach to the crisis that we are now facing. Hence, I take the opportunity to encourage all Jamaicans, Christians, and all people of goodwill to make a careful choice about taking the vaccination against the coronavirus. The facts are before us. The positivity rate is increasing alarmingly. More persons are falling seriously ill and dying, and the health services are overburdened, especially by COVID sufferers who have not been vaccinated, who have not been vaccinated, who have not been vaccinated. In addition, our regular worship, work, and school routines have been further curtailed. As the situation worsens, I unite my voice with all church and other leaders in support of the Ministry of Health, that Jamaicans view it as a serious moral obligation to protect others as well as themselves in this great danger of the virulent COVID-19, SARS-CoV-2. It is reasonable and responsible for us to trust that medical science is guided by divine wisdom in developing vaccines for the protection of human life. Christians, therefore, must lead the way, following our Savior, the saints, and all our forebearers of the faith. For we are called not to live just for ourselves, but for others, guiding our personal decisions by the law of love. It is estimated that 67% of our population here in Jamaica are Christians rather. If Christians are vaccinated, we can establish the herd immunity that is desired for normality to be restored for socio-economic, educational, and religious activities. As I call on all well-thinking Jamaicans to heed the call to get vaccinated, Christians, please lead the way. Let the Holy Spirit lead each and all of us to be vaccinated. Continue to observe all the protocols consistently. Be attentive to the needs of the weak and the sick, and pray unceasingly for the end of the pandemic. Amen.
Thank you very much, Archbishop. We're going to move now to Reverend Newton Dixon, the President of the Jamaica Council of Churches.
Thank you very much. I think I can now claim Paul's words, having heard all the very erudite colleagues of mine. I can now say I'm the least of the apostles. Apostle nonetheless. The Jamaica Council of Churches endorses the vaccination program. And I speak on behalf of the council. And I have to admit that all of us are of the masculine gender here, but there are some women who are denominational heads of the council, of member churches of the council, who also are in full support of the vaccination program. But I speak personally for a minute, because I speak as we would say as a churchman. And I speak as a churchman whose source of reflection and action is the Bible. the social ethic of the Bible is one that promotes the common good, looking out for others, particularly those who are voiceless and vulnerable and in need of help. And what we're seeing is a threat that can unravel all of those social interests that we promote. We really are dealing with an existential threat, that is the coronavirus. The virus has actually tested our character. And we've found, strangely, that the first impulse that came from some groups was a self-centered, inward-looking kind of approach. And I think we've had a chance to reflect. And this has happened at the international level, at the national level, and even as we see in individual respects. But we've had a chance to reflect, I believe. And my view is that the trend in the attitude toward the virus is changing. But it is not fast enough. We must move further and more quickly towards the position that answers the question which asks, what is the most reliable way of returning to a productive and hopeful social setting? We believe the answer to that question is a population that has sufficiently protected itself against a virulent, powerful, and lethal virus. And so it seems to us in the Council that the answer then, in addition to maintaining social distancing, wearing masks, and sanitization, it seems the best option is the vaccination. And so we commend to our people the understanding that we are interconnected, our interrelatedness as human beings and as Christians, that understanding demands we act in the interest of the common good. So I urge, on behalf of the Council, I urge all Jamaicans to look again at the facts and see how we can move and work together towards a life, a quality of life that puts us back on track for our 2030 goals. For this is, I believe, the place to live, to work, to do business, to raise families, and Minister, I always add, and worship your God. Amen. Let's get back there. Thank you.
All right, thank you very much to all members of the clergy. We're going to move into questions from the media minister. So we have a number of media colleagues who are here and who are online as well. And this is an opportunity for you, for those who are in the room, to pose their question to any member of the panel.
Good morning. My name is Tiffany Taylor. I'm from the Gleaner. My question is to Minister Tufton. Mr. Howard Gregory suggested that churches would be, well, he is suggesting that churches can be a point of vaccination. I want to know if, acting upon that invitation, will the Savlamar Hospital be given a church hall to expand their COVID ward?
Okay, so I was hoping not to have any questions today, but nevertheless, I've learned in this job to expect the unexpected. First of all, I want to thank the presentations that were made, the presenters. For the record, I really appreciate the endorsement. And, you know, you've said it in ways that I could not have, and carry with it the authority and the leadership that I may not be I am not in a position to offer, put it that way. So I really want to express appreciation, not just on behalf of health and wellness, but the government, and certainly, I dare say, the scores of Jamaicans who are on the front line trying to champion this cause and trying to overcome some of the objections that we have had to encounter. I think your endorsement is an overwhelming indication that we are on the same page, and we all mean, we all think that the vaccination program is an effective response, and there is no reason to see it in any other way, any other term, or to be uncertain about it. And I really think that, I hope that that message will get out to your respective congregations, and indeed to Jamaicans on a whole. So thank you very much for that. As it relates to your question, I think you were asking about a ward and also a vaccination center, and the two are a little different. Sav Lamar Hospital is under stress, as most of our hospitals are. Indeed, I believe we will have a press briefing this evening, because there is a cabinet subcommittee for COVID this evening at 4 o'clock to discuss some of these issues. So I don't want to preempt any of the decisions that would be taken at that level, but we are seeing increased numbers, and we are making arrangements to try to accommodate. It does not involve converting a church hall or any other facility into a hospital compound. It may involve adjustment in persons' inpatient care, keeping in only emergency cases, and rerouting the non-emergency cases to other locations, including home, and therefore providing greater space, or building out temporary structures around hospitals where we have the other facilities like oxygen, the personnel to support patients who are now increasingly affected by COVID. What is very concerning is that we're seeing in the last week a lot more admissions than we are seeing persons being released, which means that each day that passes, we have a net increase. And there's a limit to that because of the limited number of beds, which means that over the next week or so, we run the risk, well, we're close of having nowhere to put people, and even persons who are in serious conditions. So it's a real dilemma that we're going to have to confront, and some conversations will go on with government on that. On the issue of vaccination sites, we are using non-clinical locations, and I do believe that we're using some church facilities now, yeah. And the offer is fully accepted, and what we will do through the regional health authorities is to indicate, particularly now that we're moving in a phase of community outreach, where we're administering the vaccines in communities. Oftentimes, locations are limited. The health center in that community is small, and the church's reach and infrastructure is oftentimes the most appropriate location. So it's a good offer, generous offer, and it's an offer which understands the local landscape and the constraints, and we certainly will utilize it. Thank you.
Hi, good morning. My name is Asha Wilkes from the Gleaner Company as well, and I have two questions for Reverend Howard Gregory. Firstly, you spoke about that through conversations you were able to help others to combat against the vaccine hesitancy. Due to displacement, because of the COVID protocols where churches can't have a large congregation, how has this been difficult for you to reach out to members in this way? Secondly, you also spoke about the speculations of tracking devices and the 666 beast marking that is that people believe that will be implemented in their bodies through the vaccine. How is it that you use your authority to push back against these notions? Thank you.
Thank you very much. If I may respond to the second part, I didn't really speak to the 666 idea, but I certainly do say to persons that it is clear that if the interest is in tracking, the government can already track every one of us through the technology that exists. There's no need for an additional chip. Once you're using a cell phone, you can be tracked. Okay. The theological sort of reflection or lack thereof that keeps trying to connect the beast, because it's changing constantly, because 10 years ago the beast was supposed to be something else, and then this year it's the virus, next year it is something else, and they'll try and connect it. So I think that's a really useless road down which to travel in terms of trying to make that connection. But some people feel that there's something there. I don't really think there's any useful thing in terms of that application. But in terms of the limitations with the restrictions, fortunately, a lot of congregations now are online in one form or another. And in fact, where some have gone online, the audience is larger than what would normally come together for a regular service. So one has that reach. But the last 3 weeks, for example, I was in Maypen, I was in Chapelton, I was in Almond Town, and when I'm speaking to those congregations, it is not just those who are sitting before me. I want them to share the message with their families and with their communities. So I challenge them to be in the same way that one virus infected person will spread it to 5 or so. I want them to do the same with the message, to be avenues, vehicles for getting the message across. Thank you.
Good morning, Alistair Dunkley-Willis. I'm from the Jamaica Observer. Dr. Tufton, my questions are for you. The genome sequencing machine, I know you had mentioned that there were 2 that were supposed to be procured, but now that we're at the stage where the Delta variant is here, I'm supposing it would be far difficult to have to be sending samples to get confirmation when it's clear that it's on the spread. So I wanted to know if there's anything that can be done to speed up the procurement process. Also, the samples tested which returned, which you spoke about yesterday as it relates to the variant, when were those samples sent? I know you had spoken in June to the issue. I want to find out if those were samples sent from then or those were recent samples. Also, the nurses have said that they're tired. I know we can't pull nursing professionals out of the hat, but what can be done or what will be done to help to bolster the manpower that's on the ground?
Okay. The sequencing machines are on order, as I have stated before, and the delivery timeline is not fully in our control. It's a function of the manufacturers, and in one instance, the donor, which is working with CDC, Centers for Disease Control, the US, and the Pan American Health Organization. I actually was with the CDC head in the Caribbean, based here in Jamaica, this morning at the airport, and he gave me an update. Timelines are still fairly uncertain, but I know it's being worked on. Sorry, I can't give you more specifics on that, except to say that I really would want to discourage any sort of focus on the sequencing machine as a means of somehow stopping the Delta variant or indeed even treating with the Delta variant here as part of the COVID threat. The fact is that it's here, and based on the results that we have had yesterday, it's safe to say, I think, that it is here in abundance. It may not be the dominant strain, but it's certainly a popular enough strain to cause an added threat. The downside to that is that based on the science, it spreads a lot quicker, and it appears by looking at other countries to affect all age cohorts, particularly younger people, and could be so in severe ways. And so we have to be cautious, and we have to recognize the threat that it represents. Having said that, vaccines continue to be effective based on what the research is showing against that particular strain and the others. And so the theme here about getting your vaccination is very relevant, and more so now that we have this strain, this particular strain. And I think if we focus on that, it represents our best response to dealing with the threat that is on hand. So we are working on the machine, but now that we know it's here, we will continue to test at the 3 sites outside of Jamaica. But more importantly, what we need to do as a country is to protect ourselves, starting with the vaccines. On the issue of when we got the results, I think those samples were sent, I think, sometime in July. I can't tell you exactly when, but sometime in July, maybe mid-July or so, which tells us that we've had this strain here for a while, which means that, and because of where we found them in different parishes, I'm pretty sure that it's all over Jamaica. And that's what the clinicians are saying. The issue of nurses being tired, that is impatient of debate. The public health system is fatigued, tired, worn out, but are very dedicated, very committed to what they're doing, and they have really maintained a position in the interest of service to country, even at their own expense, their personal health and wellness, family, and all the other issues that they're affected by. As a country, we can do them a big favor and show support by taking the vaccines, observing the protocols, to ease some of the burden that they have to confront. Many Jamaicans are not connecting the pressures on the public health infrastructure, including people, and our own personal behavior as it relates to the protocols and the vaccines. And in a sense, and I don't want to be insensitive, we demand of them solutions to our problems without recognizing the responsibilities that we have to ourselves, and by extension to ease some of that burden that they face. And I really want to appeal to the country, as has been done here, that we see the vaccines as a very effective response, and also as a side, helping the healthcare workers and the fatigue they're experiencing. Thank you.
Well, just for my information, I might not understand clearly, but going back to the genome sequencing machine, not to say it would have been a silver bullet, but from the perspective that being able to quickly determine where the clusters are or where persons are who are infected. I know that we're in community spread, and I don't know if it is at this point sensible to do what you had done in the first part of the virus, where you had community lockdowns, etc. So, for example, if you find a huge cluster wherever, then you're able to quarantine effectively. So that's from the perspective from which I had asked that question.
Right. Well, I think that horse has bolted, to be honest with you. And I'm being very frank. I mean, the community spread and the extent to which where we have found the origins of the strain, geographic origins, that is, in the respective parishes, the opening up of our borders, the expansion of the tourism trade, the travel by the diaspora, local people. We are an open society. The countries that we're interacting with, where the Delta strain is a dominant strain, it is very, I think, logical to assume that all of those factors would ensure that the strain is up in our population in a way that requires more the protocols and the vaccine to respond, as opposed to trying to identify it in a particular community or a particular town. Testing is important to manage, to track, but when you have community spread, it's still relevant, but it requires other methods or measures.
Thank you very much, Minister. We just have two more, one online and a follow-up from Tiffany. So we go to Cassius Watson from Jamaica Social.
Hi, good afternoon, folks. This question is to the clergy that are sitting there at the table. Is it a situation that you will now be issuing official communiques to all your other pastors, reverends, priests, that they should infuse the vaccination message in their sermons? How many have been doing it, and what's the move forward from your standpoint, from your head positions?
This has been ongoing since the pandemic, encouraging our pastors and from my office sending out letters of reminders to the church community. And so this is an ongoing responsibility that as church, and I think all of us have the same position, that we continue to inform, enlighten, and remind our church communities by letters and asking the pastors to do so, to inform our congregants of the responsibility that they have to take the vaccine and to overcome all the conspiracy theories that are around and not allow them to condition their mind and allow them to become reticent with respect to the responsibility that they have to take the vaccine to limit the spread of this virus.
Okay, yes. Just to say, I don't necessarily encourage the message in the sermon. And one of the reasons when I do engage a congregation, it's more interactive around, there's a discussion that we tend to have with more interaction than the sermon allows. So there are questions that one tends to ask, which tends not to be the format certainly of the sermon in our tradition, but certainly when you can spend some time and just have people interacting and asking questions. And there is a even less formal way of engagement when my language is more rootsy, if I may use that expression, and way of engagement in that time and people are much more relaxed. That's the way in which I do it and I encourage. But definitely that the message should be getting across Sunday after Sunday and should be in the bulletin and should be in their faces, basically. Yes.
Thank you. We have used all the media channel of the Seventh-day Adventist Church to communicate. We do not encourage to talk about vaccination during the sermon, but there are opportunities during the worship service where we interact with our members. We usually use webinars, Zoom meetings with leadership and members and workers to communicate to our members and the wider community.
Basically, local churches are connected to denominations, and denominations are connected to their particular umbrella group. In the evangelical community, what we have done, since we have the support of the executive board, the full support, is that we send out to denominational heads and ask them to encourage their pastors, that's the local church now, to look at it seriously, look at the data, look at the research, and to encourage their persons to get vaccinated. And that is what we have done. I have been very strident, not in my sermon, but when I'm giving the notices, I've been very strident concerning taking the vaccine. That has created a lot of flack, and a lot of persons have taken me to hell and back. But I continue to help and support, and when they run into problems, and I've had the experiences, I try to help them to get them into hospitals, and also to tell them where to go to be vaccinated, those who were terribly against it. That's just the reality.
Okay, my question is for Dr. Peter Garth and Pastor Everett Brown. Do you detect a high level of resistance or hesitancy among your congregants, and how do you intend to eradicate or reduce that resistance?
Let me quickly say that I am alarmed at the fact that overnight, members of the clergy, members of congregations, they have become epidemiologists, neurologists, and specialists in internal medicine. And the sad part is that they get their training online, social media, and it is the flavor of the day that they pick up. And so I think that there is a fairly large amount of persons in various churches who are against the vaccine. But what Bishop Howard Gregory said is absolutely true. We have to engage them, and I have found the one-on-one engagement that it works, because persons actually, when you speak with them, they really have no real solid reasons. We saw a situation where somebody sent out a Trinidadian that since he took the vaccine, he has electricity running through his body. And you have that bulb that you can squeeze and get the light. And he put it on the arm, pressed it, and a lot of Jamaicans started calling me. And I said, I can give you an answer. I simply ran downstairs because I have those bulbs. I say, I have no wires attached, look at this. And lit up the bulb on top of my head. And how did persons respond? Do you mean to tell me that persons out there would really do this to trap us? It's a daily diet. And they rejoice and they laugh at us too when they say, look at what is happening in Jamaica. Look at what is happening in the Caribbean. They believe it. And the magnet also on your hand. You know, many persons told me that they actually were there on the phone and put in a magnet there and it wouldn't stick. It is amazing. And I tell you something too, intelligent persons believe in it.
Thank you. I'm not in a position to quantify the level of hesitancy in our churches. But I suspect that what obtains in the society and in the world is reflective of what is happening in our churches. My approach is that I ought to provide leadership and to demonstrate in a personal way by taking the vaccine that the vaccine is effective. And so, in spite of the negative, in spite of the hesitancy, I believe that as the leader of the church, I ought to set the example and continue to educate our members and encourage them to take the vaccine. And so I'm not turned off by those persons who wish to personally attack me. It comes with the territory. Yeah. I have been called to provide leadership and to encourage the members to be healthy. And I think as a Christian, the health of my members, the health of the general population is a priority. And as a leader of the church, my responsibility is to provide leadership in that regard. And I will continue to do so.
Thank you very much. And thank you to our media colleagues for those questions. I'll hand over to our minister to give his closing remarks.
Well, I wanted to find out if there's any final comment from any of the members of the clergy. Are you're all comfortable?
Just one comment, Minister. I heard from the sort of comment that I will take the vaccine if I have to travel. And I just would want to appeal to Jamaicans that our own sense of ourselves and who we are, that we see this as something we need to do for ourselves and our nation, and not because if we need to travel, Uncle Sam won't allow us to travel or what have you, or to wait any kind of external signal for us to do what we need to do for ourselves. We must do it because we have the pride and the dignity as Jamaicans for Jamaicans. And we shouldn't be doing it also just for the tourists. We must do it for all our citizens, for ourselves.
Minister, I'd like you to maybe now or at some point in time address the old question. There are a number of persons whom I interact with. Maybe younger persons too are suggesting that they are, and older persons, that they are waiting for the Pfizer and the Moderna vaccine to be vaccinated. Just speak to how effective the AstraZeneca vaccine is, and whether or not it's whichever vaccine you can get, take it.
Okay, I'm really happy that Dr. Ennis, is Dr. Ennis online, Stephen? Dr. Ennis?
Yes, Minister.
Yes,
Minister.
Okay, great. All right, so Dr. Ennis, Melody Ennis, is head of family medicine and in charge of our immunization program. I'd rather clinician answers that question, but I think it's a great question to ask because you're right. Persons have been saying to me that they're waiting. From a policy perspective, we say the best vaccine is the first one that you get. And from a policy perspective, we only bring vaccines into the country that have gone through clinical trials and have passed all the clinical tests, so they are safe. And that has been our policy for a very long time. But Dr. Ennis, what's the difference? Why some would like one over the other? And can we vouch for the safety of AstraZeneca versus Pfizer versus Moderna? Please.
Thank you, Minister. We can vouch for the safety of all the vaccines that are here in country. They have been approved not only by the stringent regulatory authorities, but also by the World Health Organization. Now, get a little bit confused with the FDA. Now, the FDA usually guarantees approval for vaccines made in the USA. And as, for example, the AstraZeneca has been granted approval for use in other countries by FDA outside of America, which would be those in the UK, for example. And those are stringent regulatory authorities. Now, the FDA specific for US and US made medications. So the Pfizer, Moderna, Johnson & Johnson were created, made in the US, and they would be so approved. AstraZeneca, made in the UK and other countries, would undergo the same stringent management of authenticity and clinical trials, proved to be safe. And as such, World Health has put their seal on these vaccines. So you will also note that there is Sinopharm, for example, out of China, that has passed the regulations in China and has also received stamp of approval from the WHO, not from the FDA, as it's not an American medication. So basically, all the vaccines prevent severe illness, hospitalization, and death from COVID. And as such, there is no better one. It is the one that is available that is best. They all will do that. And current data, even with the variant, is saying that persons possibly will still not get severe disease, not be hospitalized, and won't die. And therefore, whichever vaccines we have here in country, persons are encouraged to take them.
Thank you, Dr. Ennis. So you were breaking up a bit there, so I just want to reiterate what you said. All the vaccines are safe. All have been subjected to clinical trials. There are about 3 stages of clinical trials, including trials on humans, volunteers. All test results have been reviewed by the WHO experts, including one expert who is a part of the WHO panel who is a Jamaican, Professor Peter Figueroa, who has spoken, I think, many times publicly on the process and vouched for the process. And indeed, immunization has been part of our human development in Jamaica which is why our life expectancy is where it is, 76 years in one case, I think, for males and 78 for females. Largely because we've been able to eliminate things like polio and other threats. And so, you know, the evidence, it's one-sided in favor of vaccines and the policies that we have used to guide how we select. I've also heard of persons dying waiting on a vaccine because they got COVID, Jamaicans, and it's also elsewhere in the world. So I say that just to urge caution around this idea that we'll await one over the other and a feeling that one is better than the other. Some of it, frankly speaking, is just good branding and marketing and our biases around particular cultures. The Pfizer is more American, AstraZeneca is the more UK, Sinopharm is Chinese, and for all sorts of reasons, people have their preferences. But the truth is, they're all fundamentally the same, the process, the science, and provide the same benefits. And what you're seeking is the benefit, not the brand. And so I urge us not to allow ourselves to delay based on that. At 1 o'clock, Minister of Health and Minister of Education, Minister Favour Williams and I are having a press briefing to discuss the weekend's vaccines blitz around the Pfizer. And I will say that it will be primarily for young people, 12 to 18 years, in light of the fact that that vaccine has been proven to be safe for young people, and also the objective of trying to get school started back in September. So to the older population who may be waiting on Pfizer, where there is an exceptional case for whatever reason, I'm sure there will be some flexibility, but we really have to give our young people an opportunity. They have been out of school for a long time, but more details will come on that later on. All right, if there is no other comment you wanted to, okay, go ahead, Rev.
Thank you, Minister. It's a brief comment, and I'm intrigued by the fact that you just mentioned initiatives towards vaccinating young people, because the comment I wanted to make was really an appeal to young adults. Forget about us old people. The cohort below the young adults, and I'm speaking to young adults, the cohorts below you are the ones who are depending on you to make life safe for them. So the high school students, the primary school students, the basic school students really need the responsible action of the young adults to ensure that they can come through the system successfully and in a healthy way. And so my appeal, Minister, is to our young people that you adopt the best attitude you can with respect to the youngsters below, for want of a better term, coming after you, who need your responsible action to make sure their lives, school life, social life, economic life, religious life, is possible and meaningful. And that's pretty much what I'd like to say, Minister.
Thank you very much. So the only thing left for me to say is a big thank you to the members at the head table representing various church organizations. I think they have spoken very clearly in a way that only they could do. And I think the message is clear. The church community endorses the vaccination program and encourages all of Jamaica, including the membership of the church, to take the vaccines as an effective part of the COVID response. And as government, we are very appreciative of that partnership and collaboration around a common good, the greater good, and I think, and I hope that this message will get out to all concerned. Thank you very much again for coming, for spending the time here. And I would like now to turn over to Stephen for, is there any final comment? All right. So thank you very much. And thanks to the media, thanks to members of the Ministry of Health, the other persons who are here, Mrs. Golden representing the leadership at the ministry, for coming out and participating in this. Now, we have a lot of work to do. So let's go out and get the information disseminated, and let's help others who need to understand to come on board and to get the vaccination. Thank you. God bless you.